Let me introduce Bruce. Bruce is my grandfather-in-law that devoted his life to his family, farm, his shop, and his animals. He didn't recognize the early warning signs and symptoms of his brain tumor. It wasn't until a year later that he decided to tell his wife that he was having constant headaches and nausea. He was then diagnosed with a malignant brain tumor after several scans and a biopsy. After surgical removal, Bruce suffered a stroke post-op that left him with right-side hemiparalysis of his body. Due to the extent of the post-surgical complications, Bruce had expressed his wishes before treatment to remain at home under the care of his family and community palliative nurses. A brain tumor is a growth of abnormal cells in the tissues of the brain. These can either be benign, slow growing and contained, or malignant, rapid growing and invasive. The most common symptoms include headaches, nausea, vomiting, and problems with memory or change in one's behaviours. The Australian Institute of Health and Welfare has identified chronic diseases are the leading cause of the fatal burden of disease in Australia. Cancer is one of these chronic diseases, posing considerable burden in terms of morbidity, mortality, and healthcare costs in Australia. In 2009, the risk of being diagnosed with cancer before their 85th birthday was 1 in 2 for males. With early detection and numerous research, survival rates have increased over the past 3 decades. The National Chronic Disease Strategy Document 2006 has been developed to provide a national direction to improve chronic disease prevention and care across Australia. In response to the growing impact of the chronic diseases on the health of Australia and the healthcare system by providing an overarching framework of agreed national direction. It seeks to improve health outcomes and reduce the impact of chronic disease on individuals, families, communities, and society. The primary objectives include prevent or delay the onset, reduce the progression and complications, maximise the well-being and quality of life, reduce avoidable hospital admissions and healthcare procedures, implement best practice in the prevention, detection and management, and enhance the capacity of the health workforce to meet population demand for the care in the future. 4 key action areas have been identified in the document as essential to achieving the objectives and putting into practice the principles of the National Chronic Disease Strategy. These reflect the overall theme of the patient's journey across the continuum. These are prevention across the continuum, early detection and early treatment, integration and continuity of prevention and care, and self-management. The action area of self-management relates to Bruce and his family coordinating and delivering his care for his chronic disease, where he expressed his desire to remain at home when he was coherent in decision-making. Self-management is about the patient being actively involved in their own healthcare. This requires the person, the family, the carers, the service providers, and the health system working together to achieve better health outcomes that are tailored to the individual and their needs. Recommendations for practice involve having a collaborative approach with the multidisciplinary team from the doctor, pharmacist, occupational therapist, and the community health nurses. For Bruce and his family to be actively participated in decision-making for treatment plans, to receive valuable education on how to manage his condition and have an action plan in place if problems arise, monitor his signs and symptoms of changes, empower the family to have confidence whilst caring for Bruce, develop end-of-life care with community and palliative care services. By adapting a self-management approach that was tailored to his individual needs, he was able to remain at home in the end stages of his chronic disease with the help of his family and the nurses that kept his wishes